Glaucoma stands as one of the most formidable challenges in eye care today. This complex condition affects over 60 million people worldwide, and that number is expected to climb beyond 110 million by 2040. What makes glaucoma particularly dangerous is its silent nature. It can steal your vision gradually without warning until irreversible damage has already occurred. Understanding glaucoma begins with recognizing it as a group of eye diseases characterized by elevated intraocular pressure, commonly known as IOP. This pressure, when consistently high, damages the optic nerve, the crucial pathway that carries visual information from your eye to your brain. The normal range of intraocular pressure sits around 16 millimeters of mercury, typically falling between 12 and 21. When this pressure exceeds safe levels, it begins a process that can lead to permanent vision loss. The disease holds the unfortunate distinction of being the second leading cause of permanent blindness, particularly affecting older adults. What's most concerning is that more than 50% of people with glaucoma remain undiagnosed globally, with even higher rates in Asia and Africa. This hidden epidemic continues because many patients experience no symptoms until significant damage has already taken place. Glaucoma manifests in several distinct forms, each with its own characteristics and challenges. The most common type is primary open-angle glaucoma, often abbreviated as POAG. This form affects approximately 2 to 4% of individuals aged 40 and older, with the percentage climbing to around 10% for those 75 and above. The term open angle refers to the drainage angle in the eye remaining open, yet the drainage system itself becomes less efficient over time. Primary open angle glaucoma earns its reputation as the silent thief of sight because patients typically remain asymptomatic until substantial optic nerve damage occurs. The vision loss follows a characteristic pattern, beginning with peripheral vision and gradually progressing inward. Because of this loss pattern, affected individuals don't notice changes in their vision until the damage advances to affect central vision, at which point the damage becomes permanent and irreversible. The pathology behind POAG involves a gradual increase in resistance to fluid drainage within the eye. The eye continuously produces a clear fluid called aqueous humor, which normally flows out through a drainage system called the trabecular meshwork. In POAG, this drainage system becomes increasingly clogged or inefficient, causing pressure to build up slowly over months or years. Angle closure glaucoma presents a dramatically different scenario. This form accounts for only about 10% of all glaucoma cases, but it demands immediate medical attention. Unlike the gradual onset of open angle glaucoma, angle closure can occur suddenly when the drainage angle becomes completely blocked. The iris, which is the colored part of your eye, can move forward and cover the drainage angle entirely. When acute angle closure glaucoma strikes, patients experience sudden severe eye pain, redness, blurred vision, headache, nausea, and vomiting. The intraocular pressure in these cases typically ranges from 30 to 50 millimeters of mercury, well above the normal range. This represents a true medical emergency requiring immediate intervention to prevent permanent vision loss.
Normal tension glaucoma, also called low tension glaucoma, presents another puzzle in the glaucoma spectrum. In this condition, optic nerve damage occurs despite intraocular pressure remaining within the statistically normal range. This suggests that factors beyond pressure alone contribute to glaucoma development. Some individuals may have optic nerves that are particularly susceptible to damage, or they may have compromised blood flow to the optic nerve. Secondary glaucoma develops as a consequence of other eye conditions or medical treatments. Trauma to the eye can disrupt normal drainage patterns, leading to increased pressure. Certain medications, particularly corticosteroids used for extended periods, can elevate intraocular pressure. Other eye conditions like uveitis, which involves inflammation within the eye, can also trigger secondary glaucoma. Congenital glaucoma affects infants and young children, resulting from developmental abnormalities in the eye's drainage system. These children may present with enlarged eyes, cloudiness of the cornea, and excessive tearing. Early surgical intervention is typically necessary to preserve vision in these young patients. Risk factors for glaucoma extend beyond age, though advancing years remain the most significant factor. Family history plays a crucial role. Having a parent or sibling with glaucoma increases your risk substantially. Individuals of African descent face up to a 15-fold increased risk of blindness from open-angle glaucoma compared to other population groups. Medical conditions like diabetes and high blood pressure contribute to glaucoma risk. The relationship between these systemic diseases and eye pressure involves complex interactions affecting blood flow to the optic nerve and the eye's ability to regulate pressure effectively. Eye trauma, even from years past, can predispose individuals to glaucoma development later in life. Anatomical factors also influence glaucoma risk. People with thinner corneas may be at higher risk as corneal thickness affects the accuracy of pressure measurements and may indicate structural vulnerabilities. Severe nearsightedness or myopia is associated with increased glaucoma risk, particularly for normal tension glaucoma. Diagnosing glaucoma requires a comprehensive approach, as no single test can definitively confirm the condition. Eye care professionals rely on multiple assessments to build a complete picture. The fundoscopic examination allows direct visualization of the optic nerve, looking for characteristic changes like cupping, where the center of the optic nerve appears hollowed out due to nerve fiber loss. Visual field testing maps your peripheral vision, detecting the characteristic patterns of vision loss associated with glaucoma. These tests require patience and concentration, as you'll respond to light stimuli presented at various locations in your visual field. The results create a map showing areas of normal vision and any blind spots that may have developed. Tonometry measures intraocular pressure using various techniques. The most common method involves a brief puff of air directed at your eye, though more precise measurements may require gentle contact with the eye surface after numbing drops are applied. Regular pressure monitoring helps track changes over time and assess treatment effectiveness. Optical coherence tomography, known as OCT, provides detailed cross-sectional images of the retina and optic nerve. This technology can detect structural changes in the nerve fiber layer before functional vision loss becomes apparent on visual field testing. OCT has revolutionized early glaucoma detection and monitoring.
Gonioscopy involves examining the drainage angle of the eye using a special contact lens. This procedure helps distinguish between open angle and angle closure forms of glaucoma and guides treatment decisions. The examination requires topical anesthesia and provides crucial information about the eye's internal anatomy. Treatment approaches for glaucoma focus on lowering intraocular pressure, as this remains the only modifiable risk factor we can effectively address. While treatments cannot reverse existing optic nerve damage or restore lost vision, they can help control disease progression and prevent further vision loss. Medications represent the first line of treatment for most glaucoma patients. Eye drops work through various mechanisms. Some reduce the production of aqueous humor, while others improve drainage from the eye. Prostaglandin analogs, often prescribed as once daily drops, increase fluid outflow and have become a cornerstone of glaucoma therapy. Beta blockers reduce aqueous humor production and are typically used twice daily. Alpha agonists work through multiple mechanisms, both decreasing production and increasing outflow. Carbonic anhydrase inhibitors, available as both eye drops and oral medications, also reduce fluid production within the eye. Combination medications simplify treatment regimens by incorporating multiple active ingredients in a single drop. This approach can improve patient compliance while providing enhanced pressure lowering effects. However, the key to successful medical management lies in consistent, long term use of prescribed medications. Laser treatments offer intermediate options when medications prove insufficient or cause intolerable side effects. Laser trabeculoplasty uses focused light energy to improve drainage through the trabecular meshwork. This outpatient procedure can effectively lower pressure for several years, though the effects may diminish over time. For angle closure glaucoma, laser peripheral iridotomy creates a small opening in the iris, allowing fluid to bypass the blocked drainage angle. This procedure can prevent future angle closure episodes and is often performed preventively in the fellow eye. Surgical interventions become necessary when medications and laser treatments fail to adequately control intraocular pressure. Trabeculectomy, the most common glaucoma surgery, creates a new drainage pathway for aqueous humor to leave the eye. The procedure involves creating a small flap in the eye wall, allowing fluid to drain into a space beneath the conjunctiva. Glaucoma drainage devices, also called tube shunts, provide alternative surgical options. These small implants redirect aqueous humor from inside the eye to a reservoir placed beneath the conjunctiva. These devices are particularly useful in cases where traditional surgery has failed or in certain types of secondary glaucoma. Minimally invasive glaucoma surgeries, known as MIGS procedures, represent the newest advancement in surgical treatment. These techniques use microscopic incisions and specialized instruments to improve drainage with less trauma than traditional surgery. While the pressure lowering effects may be more modest, the reduced risk profile makes these procedures attractive for earlier intervention. The importance of early detection cannot be overstated in glaucoma management. Regular comprehensive eye examinations, particularly for individuals over 40 or those with risk factors, provide the best opportunity for early diagnosis. The goal is to identify and begin treating glaucoma before significant vision loss occurs.
Patient education forms a crucial component of successful glaucoma management. Understanding the chronic nature of the condition, the importance of medication compliance, and the need for regular monitoring helps patients become active participants in their care. Many patients struggle with the concept of treating a condition that causes no symptoms, making education about the progressive nature of untreated glaucoma essential. Family screening becomes important given the hereditary component of glaucoma. When someone receives a glaucoma diagnosis, family members should be informed about their increased risk and encouraged to undergo comprehensive eye examinations. Early detection in family members can prevent vision loss through timely intervention. The collaborative approach involving an interprofessional healthcare team optimizes treatment outcomes. Ophthalmologists, optometrists, nurses, and pharmacists all play important roles in glaucoma care. This team approach ensures comprehensive monitoring, medication management, and patient support throughout the treatment journey. Living with glaucoma requires adjustments and ongoing vigilance, but effective treatment can preserve vision and maintain quality of life. The key lies in understanding that glaucoma management is a marathon, not a sprint. Consistent treatment, regular monitoring, and open communication with your healthcare team provide the foundation for successful long-term outcomes. Research continues to advance our understanding of glaucoma and develop new treatment options. Neuroprotective therapies that could protect the optic nerve independent of pressure lowering represent an exciting frontier. Gene therapy approaches may eventually address the underlying causes of glaucoma rather than just managing its effects. The future of glaucoma care looks increasingly promising with earlier detection methods, more effective treatments, and better understanding of the disease mechanisms. However, the current reality emphasizes the critical importance of awareness, early detection, and consistent treatment to preserve the precious gift of sight. Glaucoma may be a formidable opponent, but it's not an insurmountable one. With proper understanding,